My name is Lily Gullickson, and I am a nurse practitioner student at Morningside College in Sioux City, Iowa, and I currently work as a registered nurse at Sanford Children's Specialty Clinic in Sioux Falls, South Dakota. Today is November 4th, 2019, and in this podcast, I'll be discussing the history and current status of the Autism CARES Act of 2019. I will be informing you about the diagnosis of autism spectrum disorder, in addition to how the Autism CARES Act has impacted people diagnosed with autism, their family members, and healthcare providers. According to the Centers for Disease Control and Prevention, autism spectrum disorder is a developmental disability that can cause significant challenges for an individual's social, communication, and behavioral skills. Autism is termed as a spectrum disorder as there are a wide range of symptoms requiring a lot or a little assistance with their activities of daily living. As a pediatric nurse, I've had the privilege to get to know patients diagnosed with autism and their family members, and I've understood how this diagnosis greatly impacts their daily lives. Diagnosing autism spectrum disorder is a two-step process requiring developmental screening and comprehensive diagnostic evaluation. Because autism cannot be diagnosed with a blood test or any medical test, diagnosing this disorder can be challenging. As every child thinks, acts, and responds differently from one another, the same is true for a child with autism. There is no easy cure for autism. However, effective treatment involves early intervention of therapies, dietary approaches, medication, and complementary and alternative medicine. In 2006, the Autism CARES Act was first established as a law to help expand research, increase public awareness, and expand the training among interdisciplinary health professional teams in order to better identify and support children with autism. CARES stands for Collaboration, Accountability, Research, Education, and Support. Since 2006, this act has been reauthorized and enacted 3 times, most recently on September 30th, 2019, signed by President Trump. The Autism CARES Act directly impacts healthcare professionals as it has supported the training of medical professionals to better detect and properly diagnose autism. Because of this, medical professionals have established a reliable diagnosis age and have learned that early interventions make a profound long-term impact on patients. The Autism CARES Act directly impacts individuals diagnosed with autism spectrum disorder and their family members in several ways. Because of the expanding research and better understanding of autism, patients are receiving more effective evaluations and treatment plans. In addition, trained professionals are able to provide evidence-based interventions such as therapies and alternative medicine, which greatly impacts the patient's outcome. The Autism CARES Act also provides support for LEND programs and state grants to improve services, access of care, and coordination of care for children with autism spectrum disorders. Overall, the Autism CARES Act has greatly impacted the training, research, and state innovation of the diagnosis and treatment of autism spectrum disorder since 2006. As the law was recently enacted by President Trump, funding by the federal government will continue to support research, training, interventions, and public awareness of autism spectrum disorders. Jess Lyer once said, "Children are not things to be molded, but people to be unfolded." As children with autism spectrum disorders are individuals who all think and act differently than most children, they need developmental support throughout childhood to meet their individual needs. As you have listened to this podcast about the Autism CARES Act of 2019, I hope you have learned the importance of this law in healthcare and in the lives of the individuals with autism spectrum disorder. My hope is that this podcast has broadened your knowledge about autism and you will be more aware of the prevalence of this diagnosis in the communities you live and work in. Thank you for listening.